Guys, very interesting clinical case. Emergency room, 65-year-old male presents to the emergency department with severe chest pain and diaphoresis. An ECG is performed and shows ST segment elevation leads V1 up to V4. Which coronary arteries is most likely occluded, and what specific complications should the clinician team be most vigilant for in this patient? Left circumflex side artery, mitral regurgitation. No. Right coronary artery, third degree AV block. Yes, but not in this case. Left anterior descending, LAD artery, acute heart failure. Yes. Yes, this is correct one. And the next, posterior descending artery, ventricular septal rupture. Very interesting question. But the correct answer is the left anterior descending artery, acute heart failure. So this question has two parts, localizing the infarct and predicting the more likely complication. Yes, left circumflex artery gives us mitral regurgitation. Yes, right coronary artery gives us third degree AV block. Yes, posterior descending artery gives us ventricular septal rupture. But here we've got V1 to V4. ECG findings are key. ST segment elevation in leads V1 up to V4 is the classic pattern for anterior wall myocardial infarction. The anterior wall of the left ventricle is primarily supplied by LAD, a left anterior descending. And the LAD is often called widowmaker because it supplies such a large and critical portion of the heart muscle. So an extensive anterior wall myocardial infarction caused by an LAD occlusion damages a significant, large amount of ventricle pumping muscle. The most immediate and common mechanical complication of this large infarct is a profound decrease in contractility with dropping of ejection fraction. This leads to the inability to heart to pump blood effectively to the rest of the body and incompetence to make a good diastole, so resulting in acute systolic heart failure, which can present as cardiogenic shock and or acute pulmonary edema. So high-yield takeaway, you must be able to correlate ECG leads with specific coronary arteries and their territories. An anterior MI, V1 to V4, is caused in vast majority of cases by an LAD occlusion, LAD, and due to the large area of muscle involved, it carries a very high risk of acute heart failure and cardiogenic shock. Cardiogenic shock, Philip 4. Stay blessed.